Picture this, a nurse who never gets stressed, never shows any emotions, always follows every task to the letter, and treat every patient the same. Sounds like the perfect nurse, right? Or maybe not. In fact, there's something critical missing. Emotional intelligence. It's what sets apart the good nurses from the great ones. But what if I told you it's one of the most overlooked skills in our profession? And it might even be the reason why some nurses, despite all their technical experiences, struggle in patient care. And this includes myself sometimes. So let's talk about why emotional intelligence isn't a nice to have trait. It's essential, and why ignoring it could be hurting your career more than you think. So what is emotional intelligence in the context of nursing? You probably heard of the term thrown around in training or leadership workshops, but let's get specific. Emotional intelligence, or EQ, isn't about being overly emotional or soft. It's about understanding and managing emotions, both your own and those of the people around you. And here's the kicker. It directly impacts the patient's outcome, team dynamics, and yes, even your job satisfaction. Imagine you're working in the emergency department on a busy night. The waiting room is packed, the noise level is high, and everyone is on the edge. You got a patient in pain, another waiting on a test result, and a third who just need a listening ear. How do you handle it? The truth is, it's not just your clinical skills that are being tested here. It's your ability to stay calm, read the room, and respond appropriately. In that moment, emotional intelligence is what helps you decide how to prioritize, how to communicate efficiently, and how to maintain your own sense of control. Without it, even the most experienced nurses can become overwhelmed, frustrated, or burned out. But with emotional intelligence, you become adaptable. You recognize when a patient's fear is causing them to act out, or when a colleague is struggling under pressure and needs a hand. But the first piece of emotional intelligence is that which matters: your self-awareness. You can't control what you are not aware of, right? Understanding your own emotions, especially under stress, is key to maintaining professionalism and providing the best care. Think about it. Have you ever had a day where a personal issue followed you to work and suddenly every little thing seems to annoy you? If you don't recognize that, you are already stressed or upset, and this will spill onto your patient care. Research have shown that nurses with higher emotional intelligence are less likely to experience burnout. Why? Because they are better at recognizing their limits and emotional triggers. They know when they need to step back, take a breath, or ask for support. Emotional self-awareness isn't just about managing stress, it's about protecting your own mental health so you can be the best version of yourself. Not just for you, but for your colleagues, for your patient, and for your long-term well-being. Now let's talk about empathy. The ability to understand and share the feelings of another person. This is the cornerstone of nursing. Without empathy, nursing is reduced to a checklist of tasks. Medication, check. Dressing the wound, check. But the truth is, patients aren't just collections of symptoms and diagnoses. They are people, often scared, often confused, and in a vulnerable state. And this is where emotional intelligence becomes more than just a buzzword. It becomes the most powerful tool you have in your toolbox. Imagine you're caring for a patient who's just received a life-changing diagnosis. Sure, you've explained the treatment plan. But have you truly understood their emotional state? Have you noticed the small tremble in their hand, or the glazed over look in their eyes when you delivered the news? A nurse with strong emotional intelligence doesn't just hand over the fact. They recognize the fear, the confusion, and the emotional weight of the moment. They often reassure us in a way that makes the patient feel seen, not just treated. Empathy also extends to your colleagues. Nursing is a team sport after all. When you can tune into the emotions of your coworkers, you build a stronger, more supportive team. You noticed when someone is struggling before they asked for help. And that creates an environment where everyone feels safe to share the load. So it's no surprise that emotional intelligence is often a key factor in leadership potential. And let's face it, nursing is stressful. From night shift to patient loss, the emotional toll can be immense. But emotional intelligence doesn't just help you manage day-to-day stress. It helps you build resilience over time. Nurses with high emotional intelligence aren't immune to stress, but they are more likely to bounce back from it. In high-pressure situations, emotional intelligence helps you stay focused. It's that moment in the middle of a crisis when you can separate your feelings from the task at hand. You acknowledge the chaos, but you don't let it control you. That's emotional regulation at work. Staying cool when things heat up. And here's the truth. The patient can sense when you are in a fragile state due to the amount of stress from your work. They pick up on it, and it affects how they feel about the care. If you're calm, composed, and reassures them, even in a crisis, it's not about hiding your emotion, it's about managing them efficiently. So we've talked about how emotional intelligence impacts your ability to manage stress, connect with your patients, and work as a team. But there's another layer: trust. Patients are more likely to trust you when they feel understood, when they see that you are not just treating their illness, but also acknowledging their emotions. And that is where the real connection happens. Let's take a practical example. You are caring for an elderly patient with dementia. They're confused, scared, and resistant to treatment. You could follow protocol strictly, administer the medication, stick to the schedule, and check off the tasks. But a nurse with emotional intelligence takes a different approach. They take the time to explain things slowly, reassuring the patient, and find a way to ease their fear, even if it means stepping out of the routine for a few minutes. Those small acts of emotional intelligence are what builds trust, and trust is everything in nursing. It is what helps patients feel safe, even in a vulnerable moment. It is what turns a fearful patient into one who will cooperate with their treatment plan. And it's what makes them more likely to follow your advice once they leave the hospital. Finally, let's talk about leadership. You might not think of yourself as a leader, but every nurse is a leader in some capacity, whether you are guiding a patient through their care plan or helping a new nurse navigate their first few months on the job. Emotional intelligence is what turns you into a leader people want to follow. Why? Because emotional intelligent leaders create an environment of trust, empathy, and support. They don't just delegate tasks, they understand the team's emotional dynamics. They know when someone needs encouragement or when someone is on the brink of burnout. And they're not afraid to have the tough conversations, whether it is a difficult patient or a stressed out coworker. Leadership isn't just about making decisions, it's about creating an environment where everyone feels valued, understood, and capable of giving their best. And emotional intelligence is at the core of this. So if emotional intelligence is this powerful, why is it still overlooked in nursing, education, and practice? Maybe it's because we focus so much on clinical skills that we forget the human element. But here's the reality. Nursing isn't just about treating illness, it's about treating people, and people are complex emotional beings. Emotional intelligence is what helps us connect with our patients, manage stress, build trust, and become better leaders. It is not just a nice-to-have skill, and the more we embrace it, the better we become. Not just as nurses, but as human beings. And if you want to be better at communicating with your patients, with your team, then check out this video right here on Mikhail Bakhtin's communication theory. Yes, I know I pitch it quite a lot, but that's because I like the theory. So check it out right now.